Provincial Healthcare Guides. Overview. In Canada, public health insurance is available to eligible residents. Canadian citizens and permanent residents can apply for provincial health insurance. When living in Canada, you are not covered by a federal health program. Each province and Canadian territory operate their own provincial health system that is funded by the provincial and federal governments. Coverage can be different from province to province. Although each program covers certain programs or procedures, you cannot hop from province to province. There are requirements that must be met to acquire coverage. In this video, we will cover the Manitoba healthcare system. What is MSHIP? MSHIP stands for the Manitoba Services Health Insurance Plan. It is a government-run health plan that pays for many healthcare services, including visits to your family doctor and various specialists. MSHIP provides Manitoba residents with emergency and preventive care that's free of charge. The costs of MSHIP are covered through taxes. All Manitoba residents pay for MSHIP through their personal income tax. Eligibility requirements. You are eligible for MSHIP if your main residence is in Manitoba. You were in Manitoba for at least 183 days in a 12-month period. You are a Canadian citizen, permanent resident, or work permit holder. You are a protected person. You are registered as an Indigenous person. Getting an MSHIP card. To apply for MSHIP, you have to fill out a form that you can find online or at your local insured benefits branch or Manitoba Health Office. You will need to complete a Manitoba Health Registration form. Provide your previous provinces/territories' health card number. Provide valid proof of legal status in Canada, i.e. copy of Canadian passport, Canadian birth certificate, Canadian citizenship card, certificate of Indian status, or permanent resident confirmation card, copy of both sides. And provide proof of residence in Manitoba, 6 months, 183 days, in a calendar year. How to prove your residence in Manitoba. Please provide any one of these documents, subject to the documents being acceptable to health. Signed mortgage agreement. Signed long-term rental or lease agreement, 6 months or more. Current employment confirmation, dated letter from employer on company letterhead. Notarized letter from the homeowner or leaseholder stating 1. Names of the applicants for Manitoba health coverage living with them in the residence, and 2. Length of stay. Letter from a Resettlement Assistance Program (RAP) providers/letter from sponsorship agreement holders regarding the applicant's residence in Manitoba. Or any two of these documents, subject to the documents being acceptable to health. Utility bill, telephone, cable/satellite TV, gas, water/sewer, not older than 2 months. Insurance policy, home or tenant. Property tax bill, current year. Valid Manitoba driver's license. Valid Manitoba motor vehicle registration. Confirmation of attendance from a school, college, or university, not older than 2 months. Revenue Canada income tax assessment, current or previous year, showing Manitoba as residence. Social assistance benefit confirmation. Employment and income assistance statement of benefits. Child tax benefit statement. Canadian pension plan statement of contributions or statement of benefits. Old age security statement. Until your health coverage begins, you should maintain your coverage with your previous health plan. MSHIP coverage. Dental. MSHIP usually doesn't cover dental services. However, MSHIP may cover some dental surgery if it's done in a hospital. Prescription drugs. MSHIP does not pay for prescription medicine unless you are eligible for the PharmaCare program. PharmaCare ensures that your private insurance plan may also cover part of your costs. And the Manitoba Ministry of Health has some programs that can cover some of your expenses for prescription medicine. PharmaCare is available regardless of age or disease, and/or those who have been financially affected by high drug costs. What you pay for your medication through PharmaCare is dependent on your income. If you do not qualify for PharmaCare, you can purchase private health insurance. You can click the link in the description. Extended health care. People who have high health costs but have an income that's too high for them to be included in the Manitoba Disability Support Program may be eligible for the extended health benefit. The extended health benefit may help with the cost of medical supplies, such as those for diabetic or incontinence, assistive devices, such as hearing aids, prescription drugs, vision care, dental care, if the recipient's 17 years or younger, transportation to and from medical appointments, travel and out-of-province coverage. If you plan to travel outside of Canada for a period of time longer than 7 months in a year, your MSHIP coverage will still be available for up to 2 years if you have a valid health card and you lived in Manitoba for at least 153 days per year for the 2 years prior to your leaving. MSHIP will cover a limited amount of the treatment costs if you receive treatment outside of Canada. If you receive treatment in another Canadian province or territory, MSHIP will cover some of the costs for physician and hospital services. Students and seniors. Students and seniors are covered by special programs, such as the MSHIP Plus. MSHIP Plus covers the costs for more than 5,000 prescription drugs for anyone younger than 24 who is not covered by a private plan. Seniors who need long-term care are eligible for the Manitoba Disability Support Program and will maintain their benefits through the ODB program without pay regardless of whether they also have a private plan or not. What MSHIP does not cover: cosmetic surgery, dental services performed in a dentist's office, eye exams for people between the ages of 20 and 64, except for those suffering from specific conditions, care services provided by non-licensed facilities, some physiotherapy services, preferred hospital accommodation, unless specifically prescribed by a physician, private duty nursing, prescription renewals done over the phone, completion of forms and certificates you may need for school, work, insurance, etc. Testimony in court. That completes our video about the process of getting an MSHIP card. Remember, there is a 183-day waiting period for your coverage to become active. In the meantime, if you're planning on settling in Manitoba, be sure to invest in a super visa insurance from Insurednary. It will protect you if you become sick or injured.